We're here to talk about Balint in veterinary medicine today. My name is Shana O'Mara, and I'm the Chief Medical Officer here at Dove Lewis.
And I'm Jill Rahm, and I am a credentialed leader in the American Balint Society. And I have been working with trainees in OBGYN residency, providing Balint training for them since the early 2000s.
So in veterinary medicine, we have a problem with burnout and mental health issues that I think we've all gained much clearer awareness of. And there are a lot of interventions out there looking at personal wellness, but we are exposed to a huge amount of moral distress in our practice in a way that's kind of baked into the way that we practice. The financial pressures of having to charge clients for the service to take care of their pets leads to moral dilemmas that we face every day and sometimes with every patient. We also have a very large exposure to end-of-life decisions, death and grief. So I came to Balint because Balint offers a forum that's unique in that it lets us as professionals really talk about the stressors and the rigor of clinical practice in a way that is safe and protected and still professional. We're very comfortable in coming together to talk about clinical casework, but it's very difficult for us to talk about the emotions.
Typically what happens in a Balint conversation is somebody will present a case. Again, it is a case that pops up to us. We sometimes don't know why, but often we take patients home with us and we realize this would be a good conversation to have. And then we talk about the situation that we had with that patient. And then the presenter is asked to sit back and listen while the other people in the group pick up the case for them and begin to imagine, what would it be like to be this patient or this client? And what would it be like to be this clinician, this veterinarian? And what might be going on between the two of them? In that conversation, often there are insights and agreement with this is difficult, this is challenging, and it is a very affirming conversation.
And the experience of participating in a Balint group means that you kind of get to stretch the muscles that you might not otherwise in trying to imagine all the possibilities for for a given client or a given provider. And you're oftentimes left maybe a little bit unsettled with some unresolved questions. And I think that's a really valuable thing in Balint, is that it really teaches us to tolerate ambiguity, which is inherent in everything we do, yet we're trained and encouraged to always have the right answer.
And one of the things in human medicine we are aware of is over time and with enough distress, we could lose touch with our empathy and our generosity and our ability to connect with people. And that is a very uncomfortable feeling that Balint conversations seem to be helpful in. People often talk about how they feel like their empathy has been replenished. And it's probably because they were struck with the empathy of their colleagues and they were able to remember their own.
Participating in a group like this really lets you realize how much work you're actually doing apart from the medicine, how much labor there is involved in taking care of your clients. And I think having that validated and seeing the generosity and empathy in your colleagues, it really does help you reconnect in the meaning of what we do. These are real life cases, and it's that much easier to apply to the next patient that you see. For our Balint group, we've welcomed technician staff, reception staff, client service roles. The perspectives that they bring have really helped us to get at some of the meat of these cases, and I think we've all benefited from the diversity that's in our group.
The value of having a multi-dimensional group, multi-professional group, is that you get even more insight and more views.
The participation that happens is not limited to the presenter. The presenter brings up a case that we use as a jumping off point, but the entire group participates in examining that relationship and imagining all the different ways that client could be, that provider could be. So the benefit is really to everyone in the group. There's no single case that's solved and put to bed. This is really an exercise for all of us. So everyone does participate, but there's no forcing of someone to speak up. It's a very natural process where I think we all have emotional responses, and we all feel the urge to share, and we have a nice, welcoming, safe environment where we've got the opportunity to speak up without feeling judged. And I think that's such a valuable thing, especially in our field.